Professor Kristen, and I'm actually here to walk you through a PO med pass. First thing that you always want to do before giving medications is you want to think about, and for my students, say your 6 rights. Right patient, right medication, right dose, right route, right time, and right documentation. Once you're done citing your 6 rights, then for my PO Med Pass, I would like for you to hand me your drug cards. So all of the medications that you're going to give, I would like to see your drug cards that you've written out so that you have an understanding of what medications you're giving. For my students, I would like for you to hold your drug cards so that we can see them, that they've been completed. But these are just steps that we're taking for students that are beginning with the drug cards. But I will say this, you should never give a medication that you don't know what it is for, and that you can explain to the patient what you're giving. First thing I want to do is my first MAR check. I'm going to look at my medication administration record, and I'm giving Bob Jones is the correct patient. I'm giving furosemide 20 milligrams POQ day at 8 o'clock. I'm going to give aspirin 325 milligrams POQ day, 8 o'clock. And I'm giving diphenhydramine 25 milligrams PO BID, and the first dose is at 8 o'clock. There's nothing else for me to give for my 8 o'clock med pass, so now it's time for me to go get my medications. Gathered my meds, and I'm now going to check my medications to my medication administration record. Furosemide 20 milligrams POQ day. I'm looking at comparing to my MAR, furosemide or Lasix 20 milligrams. And at this point, I want to check the expiration date. It is 2036, so it is not expired. I always take a peep at my pill to make sure that it's intact. And I'm going to set it to the edge. Next medication is an aspirin. I'm going to check my aspirin, 325 milligrams, aspirin, 325 milligrams, POQ day, 8 o'clock. And my expiration date is 2023. Look at my pill, it looks good, and I'm going to put it to the side. My next medication is diphenhydramine, which is 25 milligrams, PO, and let's see, Benadryl or diphenhydramine, 25 milligrams, comparing, looks good, 8 o'clock dose, and my expiration date is 2023. The pill is intact, and that is my first medication to medication administration record check. Now let's do the second check. So I've pulled the meds, and I just want to make sure once again that I'm giving the correct medications. So I am giving Lasix 20 milligrams, Lasix 20 milligrams. I'm giving aspirin 325, aspirin 325, 8 o'clock. And I am giving Benadryl or diphenhydramine 25 milligrams. Benadryl 25 milligrams, diphenhydramine 25 milligrams, PO, 8 o'clock. Second medication to medication administration record complete. I have checked the MAR twice. I've done 1 allergy check, and now it's time for me to go in and now do my third medication to medication administration record check and do my 2 patient identifiers before I give the medications to my patient. Providing privacy and shutting the door, I am going to come in and go ahead and introduce myself again to my patient. Hi, I'm Kristen, and I'm actually going to give you your medicines by mouth. Can you go ahead and tell me your name and date of birth? At this point, I'm going to check his armband to the MAR and also have him tell me. So he would respond, I am Bob Jones, 5/10/72. And his birthday is 5/10/1972, and on his MAR is 5/10/1972. I have now done my 2 patient identifiers. At this time, I want to ask the patient about his allergies. Mr. Jones, do you have any allergies? He responds, I have no known allergies. I'm not allergic to anything. I look at his MAR, no known drug allergies. That is my second allergy check. Now we're going to do our third medication to medication administration check. So I'm going to take a look. Lasix 20 milligrams, 8 o'clock, PO. Aspirin 325, aspirin 325, PO, 8 o'clock, correct. Diphenhydramine or Benadryl, diphenhydramine, Benadryl, 25 milligrams, 8 o'clock, correct. That is my third check. Now, while I'm talking to my patient before I give the medication, I want to make sure he doesn't have any questions. So, Mr. Jones, I'm giving you furosemide or Lasix, 20 milligrams. I'm giving you an aspirin, 325 milligrams. I'm going to give you Lasix, 20 milligrams. Are you familiar with the medication? Mr. Jones states yes, because he takes it every day according to his medical history. I go ahead though and just say, just so you know, Mr. Jones, it is a diuretic. It makes you use the restroom. It's going to help with this edema that you have, and it's going to pull fluid in, and you're going to urinate a lot. So I want to make sure to tell him that because you're going to urinate a lot, I want you to make sure you use your call bell so that I can assist you or help you, so there will be no injury to the patient. Safety is first. Also, Mr. Jones, I'm giving you an aspirin. It says 325 milligrams. I noticed in your medical history you take 81 milligrams daily. So I called the physician just to clarify, and he says, no, give him a 325 today. I'm giving you diphenhydramine 25 milligrams, which is Benadryl. That is an antihistamine, and I'm giving you that because you apparently were stung by bees, and that's what brought you to the hospital. This is an antihistamine that will prevent the histamine release, and so you won't have any difficulties with hives and trouble with your breathing. How are you doing now? He responds, I feel a lot better, and oh, I'm glad you're giving me that because I think I need that. I had 5 bees sting me in my leg this morning. So I have now explained the medications, what I'm giving. So Mr. Jones, do you have any questions? And he said, no, not at all. Do you take your pills one at a time or do you want them all at once? Mr. Jones is a healthy male that seems to be able to swallow without any difficulty right now, but I do want to make sure that he's in the right position. So I'm going to go ahead and sit him up in bed a little bit higher. Mr. Jones, I'm sitting you up in bed just to make sure you swallow your medication without any difficulties. And now I'm going to wash my hands, and I'm going to go ahead and put on gloves. I have my pill cup, my medications, and a cup of water. Into the cup, making sure that I'm not touching the medication with my hands, dropping the pills into the cup. Mr. Jones, I'm ready to give you your medicines. Now, Mr. Jones could be handed the cup, he could give the pills to himself, but I like to just put them in the patient's mouth. He might be a little shaky, there might be some underlying reason, and I don't want him to drop his medications in the bed. So I'm going to give the pills all at once. Go ahead and give him the water. Your medication go down okay? Did you swallow without any difficulty? So Mr. Jones looks fine. Mr. Jones, are you okay? Yes. Did you swallow your medicines? And he responds with a yes. I'm going to go ahead and make sure your bed rails are up, and they are. I'm going to go ahead and lower your head back down. Tell me when, where you're comfortable. He said he is comfortable. Reposition if needed, and make sure that the call bell is in reach. If you need anything, please use your call bell and I will come in, or a CNA or another nurse can come in to assist you. Can I do anything else for you, sir? And he responds, no. So I'm now going to get rid of my trash. And I'm going to wash my hands again. Now it's time to document. So I gave the Lasix at 8 o'clock hour. This is September 3rd, and I'm initialing with KB. Aspirin, 325 milligrams, 9-3. Diphenhydramine, 25 milligrams. I gave the 8 o'clock dose, and that's on 9-3 KB. I'm going to sign, and my documentation is complete.